You're welcome. Thank you for having me. Amongst health professionals, it's known as meningitis, and it's what's known as a gram-negative aerobic bacterium, which infects and causes inflammation of the meninges, the protective membrane that surrounds the brain and spinal cord. The pressure buildup is what causes most of that damage. Less severe but more common forms of meningitis can be contributed to viral and fungal infections, but still the deadliest form is bacterial, and yet this is also the only form that can be prevented through vaccination. No, this is what makes meningitis so tricky to diagnose. Many doctors in emergency rooms and private practices, they don't recognize the symptoms because they happen so rarely. Also, the symptoms are very similar to the flu, typical things like vomiting, nausea, headache, and even high fever. But they can also include those distinct features such as purple spots, stiff neck, sensitivity to light, and an unwillingness to eat, especially among smaller children. But the keys to identifying meningitis outside of those few meningitis-specific ailments, which may or may not be present, is the quickness of the symptoms. They manifest themselves so severely and rapidly in just a few short hours. The number of infections may seem small, but meningitis is still dangerous. It can infect anyone, even seemingly healthy people, including top athletes, and it occurs in all stages of life, from the infants to the parents to the grandparents. A most recent case involved a 39-year-old male triathlete. He barely escaped death by having a 3-week coma and a double amputation of his legs. Uh, a more concerning fact about bacterial meningitis is that it kills 21% of those who are infected with it within the first 48 hours of contracting the disease. That is correct. Well, about half of those who survive bacterial meningitis will have to live with severe impairments such as loss of cognitive ability, amputation of appendages, loss of hearing and or vision, and in the worst cases, paralysis from the neck down. Not to mention those emotional damages that are caused by the stigma associated with all of those physical disabilities. Yes, about 10% of the general population and 25% of teens are carriers without ever knowing that they have meningitis infections because they gain immunity to it. But that isn't to say they can't easily spread it to others. really everyone. Outbreaks have been steadily increasing since the early 90s, and not just people in dorms and military barracks can get it. Other risk factors including smokers, those who are exposed to secondhand smoke, child care workers, pregnant women, small children, those living in close quarters, of course, with the association, those working closely with animals, anyone with a compromised immune system, recovery from surgery, or even those who just frequently travel. Everyone needs to get vaccinated because everyone is really at risk. You don't know who you could get it from. The carriers don't exhibit any warning symptoms. It's a common misconception that if you live in dorms or military barracks, that you don't need the vaccine. But many of the bacterial meningitis deaths have been in individuals that thought this exact idea. They didn't receive the vaccine, and they really could have prevented their own death. Exactly. And with so many bacteria becoming antibiotic resistant, coupled with the already low recognition rate of meningitis by medical professionals, it's extremely important that everyone become vaccinated. It's a good question. Up until recently, an infant vaccine wasn't really available, or at least widely available. But British scientists have been able to create a safe and effective vaccine for children 6 months older or older. The Advisory Committee on Immunization Practices recommends this vaccine for infants, as well as the traditional MCV4 vaccine already used in older children, preferably particularly around the age of about 11. Yes, especially if you're planning on traveling or if exposed to people who might already have bacterial meningitis, like daycare workers. Yes, there are such programs like Voices of Meningitis, I believe, do that. They raise money to support affected families for therapy, educate families about getting the vaccinations, and educate doctors about the prevalence of meningitis infection. Take care.